Okay, so questions? Anders?
Thanks a lot. I mean, it's very interesting to see how we fight basically the same problems in many countries, and I think this is a signal that maybe we could be better at working together than we've been during this pandemic. Two questions. One, about mandatory vaccinations. I'm a bit interested in why you turned to that in Austria specifically, and maybe why you did not turn to that in other countries. We did not turn that way in Sweden. And thus, is there really any evidence that it would be better if you make it mandatory? That's the one question. The other question is this about essential services, how to protect them. Because I think that's very, very difficult, as you said, to define what it is. I remember in the last pandemic, we touched on it, and it ended up that the ice hockey team in one town in Sweden got vaccinated because the town thought that was the most essential service they had, which can be discussed. And this time we managed to avoid it completely, which I think was very good. We had a big problem with health personnel because, as you said, there is really only a fraction of them that were exposed in any meaningful way, and that was very difficult for the healthcare services themselves to handle it. But interesting to see how you worked with it. Thanks.
Yeah. The mic.
I did not quite hear what you wanted to know. Why the vaccine mandate was...
Why you choose to go the path and call for a mandatory vaccination?
Oh, well, nobody knows that. That was just a very sudden decision by the then Federal Chancellor. And after having mantra-like stated that there will never, ever be an intrusion in the freedom of the person with a mandate. But so we don't know. And the problem was that after they have announced this a mandate for everyone, they didn't even dare to make legally a mandate for healthcare workers. So I don't know, but we kept looking at Sweden always. We saw you also in our TV, and I mean, many times, because Austria and Sweden are not so different from you have 1 million more, but the age distribution is about the same. You have more square kilometers. But I don't know. I think there is really a fear which is not understandable, but through history and maybe the past of National Socialism, of vaccination, which is not something that was fashionable. And the only mandate ever was for smallpox.
Maybe to answer the second question. So I think one of the reasons why there's a general tendency to shy away from including essential services is that the definition of that group does not belong to the healthcare sector, right? So you suddenly move responsibility out of the healthcare sector, and the considerations that these decisions are being based on are completely different. That includes national security as an example, right? And it's interesting, actually, whether or not in the current international situation, that decision might have been different in a country like Norway, where, for instance, the armed services might have been prioritized to a greater extent. I think the experience was similar in that we tried to avoid it. And I think the idea was to say, by limiting it to sort of the worst possible scenario, we've addressed where we would want to engage with it. So it was named, but we didn't drop that list, mostly because we weren't sort of allowed to do that anyway. But the lists were being prepared. So there was a different directorate that worked on this, yeah.
Sorry, can I say something from Spain?
Yes, and if you, did you say why you didn't go the mandatory way, or if you can comment on that also?
Oh, yes. I want to say that in Spain, there was a problem about the terms, because in Spain, we distinguished between 4 concepts. One is forced vaccination, the other is compulsory vaccination, which are not the same. Forced vaccination, this means that the government is able to force you to be vaccinated. Compulsory vaccination means that you can decide not to be vaccinated, but you are going to pay a fine, which is different. And also voluntary and non-compulsory vaccination. In the Spanish strategy, we said our strategy is based on non-compulsory vaccination, which is different to voluntary vaccination. You can decide not to be vaccinated, but you don't have the right to be treated the same when you have decided not to be vaccinated. This is the idea. So when you are talking about non-compulsory vaccination, means that from an ethical perspective, you are not going to treat the same people who are accepting to be vaccinated. So they are accepting solidarity, and people who are not accepting to be vaccinated. I think that this distinction is important, because one of the problems about the vaccine strategy was related to the right to be treated the same. So we need to distinguish these four concepts, because compulsory and forced vaccination are not the same. One of them means a fine if you are not vaccinated, and the other means that you can be forced, which is different.
Okay. Ross?
Thank you. So I have a question for Jasper. You said that reciprocity didn't make it to your final list, which I find curious, given that prioritization landed with healthcare workers, and the arguments for supporting healthcare workers in priority often hinges upon drawing on the concept of reciprocity. So if you could speak to that.
Yeah.
And I just want to compliment my colleague from Spain for citing Unamuno, because I've been nudging my colleagues to read them, but also a little Benthamite legacy. So Edwin Chadwick, who put in all of the reforms for mains and drains and public health reform in the 19th century in the UK, when he retired, he actually made in one of his final speeches, made a very clear argument that actually utilitarian reforms, and he was very much, there's a long shadow of utilitarianism in public health ethics, but he was at pains to show how this actually improved equity by improving the lots of the most disadvantaged, that without taking that kind of consequentialist lens, there was no way that there was going to be improvement in population health. So thank you for the Unamuno and the contrast with Bentham, but I think there's a little bit more in consequentialism that has equity-enhancing possibility as well. Thank you.
If I come quickly back to the first part of the question, Ross, I think what did the heavy lifting was an instrumental value of healthcare workers, which sounds cynical, but I think in that context was more about protecting capacity. It's important to note that this particular system with prioritizing high-risk groups higher and then only switching to healthcare workers in a scenario where there was uncontrolled spread was actually discussed with and aligned with medical interest groups. So this wasn't some sort of decision that we made, but we got support from the Norwegian Doctors Association for that kind of model, because they agreed that there's a tendency in crises to not exercise self-control when it comes to defining who should be prioritized, right? And that there's a very liberal definition of who's an essential healthcare worker. So they felt that was a useful way of reframing a demand. And reciprocity simply didn't make the list because people felt that it was already covered by this sort of approach. Yeah.
Someone else?
Thank you. We talk about lessons learned, maybe lessons observed is a bit better. I think learning is a different process. But I was thinking that the next pandemic or next crisis will not be the same. So considering the ways you developed your vaccination strategies, I mean, next time it might be children that are dying, or it might be more contagious or more lethal. What sort of do you bring with you to the next pandemic in terms of setting priorities for vaccinations? And so what are the generics? Can it be copied the way you did it, or is it rather the process of developing that you bring with you?
That's a wonderful question. Can you all answer it?
Sure. Yeah, of course. So I think that's a fair question. I don't think the particular configuration, for instance, the group of people that we pull together would be representative for all scenarios. I think what's often underrated, because we have this sort of tendency to rely not just on scientific expertise, but sort of individual experts that become sort of spokespersons, and I think this was observable in very many countries. I think what's sometimes underrated is sort of the boring administrative part of this, right? Putting together a working group, inviting people, having sufficient resources to staff meetings, prepare meetings, send out notes, write notes, do all of these things, that wasn't in place. And I think if you had a kind of system where you had an overview over experts in different fields, you're completely right, we don't know what the next crisis is, but we can have a fair guess, right? There's a spectrum of what's possible. And moving closer towards a system that reactivates an existing plan rather than starting from scratch would also in some sense, I think, preserve a sort of institutional memory, right? Because at the moment it's very much dependent on how much of an organizer an individual is and how important they think a particular aspect is. So I think, speaking from the Norwegian experience, I think it's doubtful whether or not this group would have existed if I hadn't been employed at the Institute at the time, which is not to reflect sort of on my importance, but rather to say that small, almost random effects can make a difference here. And by putting this, for instance, into preparedness plans, which ultimately are the one document that everyone then pulls out and subsequently ignores, but still pulls out at the beginning, I think that would be a good way of starting the process, yeah.
Christiane.
Yeah, I think this is a very interesting riddle or problem, because when you say that there are children, the targets are completely different, but actually the ethical principles remain the same, according to which you have to prepare a scenario where you can help. But you will have, regarding to the corona, you will have a complete different situation with closing schools. You will have a complete different situation with infrastructure, because as they are mainly adult, it will be less of a burden for the infrastructure. And it depends on how the contagion is happening, because this might again maybe even come back to lockdowns if it's very lethal and affecting children. But you have to learn, you have to collaborate internationally. You have also, regarding drugs, to look at the biggest possible clinical trials, and also regarding the repurposing of drugs. But you have to have data. But the principles will always be the same.
Mikael.
Yeah, well, I think principles discussed and agreed upon when it's calm, when it's not a crisis, and a robust administrative structure, as you mentioned. I think that's all there is, and of course a good education in ethical reasoning and decision making at all levels in society.
If I can just follow this up with one point. I think what's surprising is that we all agreed throughout the pandemic what kind of knowledge we needed, right? For political decision makers, they needed to know what interventions are effective, what's happening if we don't do anything, what's sort of the null hypothesis. What is this going to cost us, right? So the economic aspect of this, for instance, was something that we as a public health institute were fully unprepared for. We paid consultants in the beginning to do economic analysis, right? Because it's not part of the decision-making process. And it doesn't really matter what kind of pandemic scenario you envision. A lot of these questions, and that goes back to Ross's point, I think, in the beginning, the questions are almost generic. And if you find yourself surprised even by those, and not sort of some sort of freak characteristic of one particular crisis, I think that's a sign that you're underprepared in that field. And I think we found that at a lot of stages, yeah.
Federico, do you have a comment on this?
I think that experience is useful for the future. I think to have a multidisciplinary group of people, independent body of people deciding the prioritization is a good experience. And I think that also to have there people with enough knowledge about ethics is also important. I think that we have learned, absorbed, that ethics build trust, confidence. I think that the ethical discourse is better than the mere scientific discourse, because when you are talking from an ethical perspective, citizens will realize that you are talking about people, you are talking about dignity. I said many times that we are not talking about vaccines, we are talking about people. The prioritization is about vaccines, but considering people, no vaccines. And finally, if we are talking about a pandemic which is going to affect mainly children, I think that the debate is different, because when we are talking about children and compulsory vaccination, we are talking about that the people who are going to decide are not the children, are the parents. And the parents, they can do whatever they want, but not against the health of children. So for me, compulsory vaccination in the case of children is something acceptable, because parents cannot put in a risk their children. They can put in a risk their self, but not their children. They are always to work in favor of the best health or the best decision for the health of their children. So for me, compulsory vaccination and children is a different debate that when we talk about adults and vaccination.
We have time for a final question. Laurence.
Thank you very much. Yeah. Well, it's just first a comment, because I think we're talking about mandatory or not mandatory, but I think there was a gradient, because depending on the country, the condition, even though very few countries, most countries did not have mandatory requirement for vaccination. However, we say the life of those who were not vaccinated were really tough sometimes, because they have to go through many different tests to access services and so on. So I think the situation is a bit less black and white than mandatory or not mandatory, de facto. My question is more about transgenerational impact of the strategy in the pandemic. I know in some countries, like, young people felt that they were kept hostages because they were considered as a threat towards older persons and so on. And I just wanted to have your comment on this, whether you think it would have an impact on the way we are getting prepared for a future crisis. Obviously, if the crisis is, for example, if children are more at stakes, then the situation will be different. But I'm interested in this impact throughout generations within a country, depending on the strategy that was kept and the perception of the strategy between generations.
Who wants to?
Well, Laurence, yeah, when you ask on the impact of the generation, it will also depend on the way of the contagion and everything, I would say. And what we still miss in all the countries is how do we treat families with vulnerabilities, parents of children with rare diseases, and people who are at high risk. Here for them, we have sort of a return on blame or something like that. All of a sudden, they have to be the one who are kept out of society. They don't have the justice of participating in society, because they, when we go back to a normal, so-called normal life, they still have to live somehow with avoiding their children or their family to elderly parents suffering on whatever to get sick. So I think these are things we still need to overcome and find out in this specific pandemic of today before we can think of how we should tackle a future one when we're not ready here.
I think this is a really important question. I think it's the one that we've all struggled with during the pandemic, and I think for two reasons. One is it's really difficult to prove the counterfactual, right? So I can start by saying, well, if I hadn't closed down schools, then children would have had a more normal upbringing during that time, but I don't account for the costs to both society and to children, for that matter, of not doing that, right? So you can point to other countries and you say, well, some countries didn't do that and things were fine, and you can try and compare these countries, but it ends up being a very large hypothetical example in the end. I think what we can see, and usually once you have better data and you model retrospectively, you can see that some responses were perhaps not the right dimension, that we too quickly moved into one direction. I think that's a lesson in and of itself. But I think it's really hard in a crisis to demand of those who are handling that particular crisis to take the long view, because there's also the element of how long a view would you like to take, right? If you increase the time horizon significantly, any action you take now, becomes almost irrelevant, and you should only focus on what the long-term effect is. And that's, of course, taking it too extreme. But I think if I just sort of recount that from experience and the meetings and decisions that we made, I think it was sort of based on a feeling that this was epidemiologically necessary. And if it was necessary with the goals in mind that you had defined, right? And if it was necessary, then it was interacted. And that was sort of the cost evaluation. But there wasn't any proper way at the time to balance that, no?
Okay. I think it's... okay, Federico?
No, it's only that I think that one of the lessons that we should learn, in my opinion, is that in the next time we need a real European strategy. We have developed different strategies with similar ethical values, but as we had about the central purchase of vaccination, the European Union had a very strong, very important position, buying all the vaccines for all Europe and all this central distribution of vaccine, that it was a real success. I think that we need also, in the future, a European strategy, because I think it's the idea of strengthening the position of the European Union, to have people confidence in the European Union. And in this time that we have this problem about Ukraine, we need to have a strong European Union. It's the only way to address all these problems that we are going to have in the future. So for the future, one of the lessons that we should learn is that we need this European strategy for the prioritization, not only at the national level, at the European level, because we are sharing the same values, the same principles, and if we compare our constitution, our rights, we have the European Convention of Human Rights, we have the Charter with the same rights for all Europe. So for the future, one strategy based on European ethical principles for all the European countries, I think is the best thing for us and the best thing for the European Union, which is a very important institution currently.
Mikael, did you want to add something?
Nothing to add.
No. So Federico, Mikael, Jasper, and Christiane, thank you very much. And